I'm Mike O'Brien, and this is my wife, Suzanne.
And we are involved with Alzheimer's, and that's how we started with JEM Research, and it's been a journey. We lived up in upstate New York, and Mike was a financial advisor, and he came home one day and said that he's noticed something that is happening and he needs help to perform certain tasks at work. And it was a concern over quite a few months. But prior to that, I noticed different things that were happening with Mike, probably 2 years prior to that. So that's going to be 2013.
Repeating questions.
Yes. Asking him to do a task, and he would come back and not complete it, or forget things and go to the market to get a couple things and come back with one of them and a whole bunch that we didn't need. And it was becoming a problem. And we decided to move to Florida so his son could take over the business and take his book. And it was a slow process when we moved to Florida. I said, if we're moving to Florida, you're going to go get tested. You need to be tested. There's something happening. I Google searched because I also started to go to the educational conference that was held here. So I started to educate myself once Mike was diagnosed, and he was diagnosed by the other neurologist. But when he left, it was an opportunity to find a better fit for us. And we went up to Atlantis, and we never heard of Atlantis. We were new to the area. I'm thinking it's by Miami, not realizing how close it was to us. And the new neurologist said, have you ever considered joining a clinical trial? And I said, absolutely not, because we were told that you had to go off of all your regular medication that you were taking. And he said, I said, that's what the doctor told us. He said, well, what kind of doctor was he? I said, he was a neurologist. So
he shook his head.
It was an eye opener, but he said, would you consider, joining a clinical trial? And at that point it was, why not? We'll go and do the initial.
It sounded like a good idea.
Yeah.
It's interesting.
Yeah.
And so, I'm open-minded, so I would gladly do stuff like that.
So he said, I am connected with JEM Research Institute, and that was Dr. James Goldenberg, who we initially went with. And so we made the initial appointment, and it was the best thing. It was from the very beginning, our initial meeting at JEM Research, that was soothing to us. It was, they cared about us. And, with a diagnosis of Alzheimer's, we were scared out of our minds. We started to educate ourselves, but we needed help, and it was soothing. It was the beginning of a great family experience. It's been wonderful.
Yeah, we felt lucky that we got involved in it,
Mm-hmm.
and it's worked out as well as it has. I would think when people start something they're not aware of, or it's the first time, that would they be nervous and inquisitive. So I would say be open-minded, have a list of questions, but let them give you the format and layout of what to expect in the future. And have an open door where they can feel free asking questions back and forth, as we've always done. and continue that way. I think you have to ease into something that you've never done before. And that's a comforting way to go on that journey.
When we started, we had no expectations, but we felt comforted, and we didn't know what drug or what the process looked like. It is a commitment, and it's a commitment on our part and on the JEM's part also. We lived up to our commitment, and they certainly went above and beyond in their care of us. You have to make time for, Mike was on an infusion, so, but you also have the evaluations, and you have to do blood work, and you have to maybe do an MRI or a CAT scan or a PET scan, and that's all a commitment. But I think once you get involved, everything is worth it. It's, you
relax behind the whole process because it's all unknown to you, and you work your way in it. And lucky for us, we were surrounded with good people that we were dealing with, and we were comfortable with it. So as we progressed, we got more confidence and felt more committed to the whole process.
We live in a small community, 55 and older, and we have since introduced 2 couples to go get tested, and one has since joined JEM, and the other one found a different facility to join, but they saw Mike and they saw how he interacts, and there's still life in him, and nobody would know in our social group that Mike has Alzheimer's. And yes, we're very blessed, but for other people to see what we've gone through in our journey, and we've also had 5 other people from our community said, we heard your story and we need to go get tested also. So 5 individuals, and right. It's wonderful. I do have to say that we do a support group, and it's connected with JEM Research, which has been fabulous, and we look forward to doing that. And at one of our last meetings, we were talking about what is in our future, because Mike's study has concluded, and we're going to take another journey, hopefully in the near future. But I said, I miss being at JEM. I miss the support.
There's a level of comfort you get.
Sorry. But the other couple that were sitting there, they're in a different company, a research program, and it's not JEM. And they said, we've never gotten that. We've never had that feeling. And I said, we looked forward to going to JEM. We still go up and visit and bring goodies and whatever to the support system, but everyone is welcoming, even if they're not connected with you personally. They are part of that team, and they all have smiles on their face, and they're all welcoming, and they're concerned. And even though we're not directly right now connected with JEM, and hopefully we'll get back into some program, we would feel comfortable going in there and asking for help and asking for an opinion. I don't think we'll ever lose that bond.